Good afternoon, everybody. Welcome to today's seminar. I want to say a big shout out to everybody joining us via the phone. We have the folks in the regions and the folks that are working at home, so we appreciate you taking the time to join us today. I'm Diane Shook, and I work in the Division of Pay and Benefits. I'm very excited to be here today. We have two important topics of interest that I'm sure that you'll be able to gain a lot of information about. We have Ms. Jane Scheidler from the Long-Term Care Partners. She's here today. She's going to be providing an overview of the dental and vision program that's available to federal employees. She'll also give us a summary of the long-term care insurance for federal employees. Following her presentation, we have Mr. Dave Herka. He is the federal employee representative for Blue Cross and Blue Shield. And Dave will be here today. He will discuss mandates and different coverages under the different parts of Medicare. He'll be able to navigate us through the decision-making process to determine whether or not you should elect Medicare Part B. So before we dive into the seminar, we need to go through a couple of administrative notes. Would you please keep your phone on mute throughout the entire presentation if you're not asking a question? That's very, very important. And we also ask that you hold your questions until the end of the presentation or when the moderator opens the phone lines. During the questions and answer period, we also ask that the folks in the audience please go to the microphone. That's very important you ask your question there so the callers can also hear the question and the answer. The phone lines will be unmuted by the moderator for you to ask your questions. We also are extending an opportunity for those who wish to email us with a question. We have a mailbox that will be monitored throughout the seminar. Please feel free to send your questions to the HR Center Help Desk at cms.hhs.gov. You can also use the same address if you need assistance with today's seminar. Very important, if you would please complete the survey questionnaire. That's very important to us. We value your feedback. Feel free to also include any topics of interest that you would like to have us consider for future seminars. And if you could please turn in your surveys at the table outside the auditorium, and the other folks can also send your survey to the HR Center email box. So I want to introduce our first speaker, Ms. Jane Scheidler. Ms. Jane Scheidler is an account representative in the Program Promotion Department at Long-Term Care Partners. Long-Term Care Partners administers the federal long-term care insurance program. Jane joined Long-Term Care Partners in 2014 as a customer service consultant, assisting members of the federal family with all aspects of their policies. She became a member of the Program Promotion Call Center team in August of 2015 and was recently promoted to account representative. She works directly with federal agencies to facilitate long-term care training and education, both on-site and through virtual channels. She's a certified long-term care insurance consultant and a long-term care professional. She currently lives in Exeter, New Hampshire, with her husband, 2 kids, and their black lab. Please join me in welcoming Jane to the stage.
Thanks, Diane. Thanks all for coming, and hello to all the people who are working at home. So as Diane said, my name's Jane. I work in our office in Portsmouth, New Hampshire, Long-Term Care Partners, and we administer these 2 federal programs, Benefeds, which handles your FEDVIP, as well as the FELTSIP, the Federal Long-Term Care Insurance Program. So I'm going to give you a little bit of an overview on how both of those programs work today. So what actually is Benefeds? Benefeds administers the Federal Employees Dental and Vision Program. We have a 24/7 website where people can shop and compare, enroll in, and manage their FEDVIP plans. It's a really great, easy-to-use website. And if you haven't looked at it or created an account. I suggest that you do that, especially with open season coming up, in case you need to make any changes. So the FEDVIP is a pre-tax benefit for active employees. It's separate from your FEHB, the Federal Employees Health Benefits Program. You must take action during the federal benefits open season if you want to make any changes to your existing plans. This program does auto-enroll every single year. So options to enroll in a plan, change your plans, or cancel your coverage outside of open season are very limited. So you want to make sure, again, I can't stress enough how important it is to make sure you make any changes during open season, the 1 month window. Oops, sorry about that. This clicker is a little touchy, sorry. So, I'm sorry. Yeah. A little bit different on this one. So dependent eligibility. So what about family member eligibility? So FEDVIP and FEHB rules for family members eligibility are different. Eligible family members for the FEDVIP include, as you can see, spouses, all legally married, opposite sex and same-sex spouses, unmarried dependents under the age of 22, including eligible biological, adopted, foster, and stepchildren, and then children aged 22 or older who are incapable of self-support due to mental or physical disabilities that existed before the age of 22. So those are the dependent eligibility requirements. There we go. So what plans are available under the FEDVIP? As you can see, there are several dental plans: Aetna, Delta, Dominion Dental, Emblem Health, FEP, Blue Dental, GEHA, Humana, MetLife, Triple S Salute, and United Concordia. And then the vision plans include Aetna Vision, FEP, Blue Vision, United Healthcare Vision, and the Vision Service Plan, the VSP. On the website as well is a great comparison tool that you can use, so you can find some basic coverage information about plan options and compare what they offer and the premiums as well. So kind of the differences versus, with benefits versus the carrier function. So what benefits does, it's basically, it's an administrator. So they take care of all the paperwork. So eligibility, enrollment, plan changes, QLEs, which are qualifying life events, billing, if you need any address changes, and all sorts of communications. Now the FEDVIP insurance carriers are the ones you call if you need to find out about your benefits and your coverage, get new ID cards, get the provider networks, they'll give those to you, submit claims, and any other first payer processes that might occur. So that's the difference really between BeneFeds and the FEDVIP carriers themselves. So think of BeneFeds as the executive assistant kind of person that takes care of all the paperwork. So that's basically the overview of BeneFeds, and then the other part, other company basically that's under our roof is the FELTSIP, the Federal Long-Term Care Insurance Program that you're all also eligible for as well. This coverage is coverage that covers you when you can't take care of yourself anymore and you need help, or you need custodial or informal care, and those are assistance with your activities of daily living. Now, they're not listed up here, but ADLs, or activities of daily living, are bathing, dressing, eating, transferring toilet incontinence, or if you need help with those because you have something like Alzheimer's or dementia, a severe cognitive impairment. So this is insurance that covers those things when and if you ever need it. And it's only for you, the federal family, so federal employees, retirees, and active and retired military. The reason this is important, one of the reasons, is that people are living a lot longer, and on average, 70% of people over age 65 are going to need some kind of long-term care in their lives. And long-term care can quickly drain all your retirement. Many of you might know some people or have had personal experience with this, but it can be just a very stressful time for you, for your loved one, financially, emotionally, physically. So a lot of people think as well that their health insurance or your Medicare, your Medicaid, your TRICARE, your FEHB will cover those costs, but just remember that they don't. The only thing that covers those costs is long-term care insurance, and it's a benefit that is for you as a federal employee. So with the FELTSIP, the coverage is completely comprehensive. So it's going to cover you in a nursing home, an assisted living facility, as well as care at home. And your home care can be formal caregivers who come in to take care of you, or informal caregivers like family or friends or neighbors. So it's a great way to keep yourself covered if you ever need it. If you need it and you don't have it, think that you got to kind of remember that it's too late to get it once you need it. You have to get it before you need it. So that's kind of how the FELTSIP coverage works. It's also, we kind of went over this, so the benefits and the FELTSIP, the Federal Long-Term Care Insurance Program, is sponsored by OPM, Office of Personnel Management. Our underwriter for the FELTSIP is John Hancock out of Boston. It's also the largest group long-term care insurance company anywhere. We have over 270,000 enrollees. The coverage is completely portable. So that means that if you got a plan, or if you have a plan and you left federal service, it's yours to take with you wherever you go, as long as you continue to pay the premiums. That goes for qualified relatives as well. And then under eligibility that you'll see here, I told you that all of you are eligible employees, annuitants, active retired military, but also your spouses, your adult children, 18 or older, even if they're grown and out of the house, parents, parents-in-law while you're still working, and domestic partners. They're all eligible to apply. They're also eligible to apply even if you do not have a policy. So keep that in mind as well, that if you might not want one, but someone in your family might, you don't have to have a policy. You don't have to pay for it. They can do it all on their own because all the policies are individual. Another thing about the FELTSIP that's different from benefits, you can apply at any time. There's no open season. So the premiums with the FELTSIP are based on your age at the time you apply and the level of coverage that you choose. So again, you don't have to wait for that 1 month window, November to December, to apply. You can do it at any time. And that goes for your qualified relatives as well. So with the FEDVIP benefits, they have this great virtual benefits fair. I don't know if anybody attended it last year. A show of hands, has anybody heard of it or seen it? No? So all these carriers attend the virtual benefits fair, and it goes from November 12th to December 10th, but on November 13th and December 5th, from 10 to 5 Eastern, you can actually chat with people from all of these different companies. It was a big hit last year because some people all the people working at home especially, you might not get to the benefit fairs, the health fairs, the wellness fairs that we do throughout open season. You might want to talk to somebody but don't have the chance, so this is the time to do it on those chat days. And then otherwise you can just go in and check it out, and there's tons of information on that virtual benefits fair. Our department has worked really hard to update this and put it all together for you, so check that out if you get a chance. And that's all I have for you today. It really was kind of an overview, a quick briefing of the FEDVIP and the FELTSIP. Our office, like Diane said, is in Portsmouth, New Hampshire. We're open Monday through Friday, 8 to 6. If you have any questions at all, you're free to call us and get information about either one of the programs. Does anyone have any questions that I could answer for you today?
So if you have questions and you're in the room, if you could use the microphone in the center aisle, that would be helpful. Let me also remind folks who may have logged in a little bit after we started that we can receive questions via the email inbox. It's hrcenterhelpdesk@cms.hhs.gov, and we'll present those questions to Jane if there are any. So we have a question in the room, and then we'll open up the phone lines momentarily.
Thank you. Hi. Thanks.
So before you start, Jane, there's a little on-off switch on the back of that microphone, Tiana.
There we go. Testing.
There we go.
Okay. Hi, I'm Tiana. Thank you for the presentation. Does the FELTSIP apply to disabled children?
That's a good question. Thanks, Tiana. So the FELTSIP is medically underwritten, so you have to be in reasonably good health. So I don't know what the disability is, but on the application, which if you go to ltcfeds.com, or you can call us and we're happy to mail one to you or email it to you, on the application in Part 4, there are the 6 automatic disqualifiers. So if you answer yes to any of those, that means you're medically ineligible to apply. But again, I don't know what that disability is. It might not be in that group. I don't know, but check that out or just give us a call and we can answer that question
Thank
for you.
you.
Sure. Thanks for your question.
Hi there, my name's Stuart.
Hi, Stuart.
In the federal long-term care insurance plan, can you tell us about why and how premiums increase regularly?
So, well, we had an increase 2 years ago across the board, but we hadn't had one since 2002. Do you mean that, or do you mean like do you have a policy?
No, I don't.
So they don't increase regularly. They increased, like I said, 2 years ago when the contract renewed because the actuarials realized that there wasn't enough money in the experience fund that we have to pay claims for 25 to 35 years out. So they had to increase premiums at that point. And again, across the board, pretty much everyone was affected. But every single person who was affected got 3 to 5 choices to either keep their premium the same and decrease their coverage by a little bit, or take the increase, or increase a little bit, or whatever the case may be. We did give everyone many options, but the only other way your premium increases regularly is if you have something called the future purchase option, that every 2 years you get the option to buy more coverage. So if you accept that, your premium increases, but your benefit amount goes up as well. Otherwise, if you have and this is getting into a little more deep, if you had an automatic compound inflation option that went along with your premium usually stays the same, but your benefit amount goes up by either 4 or 5%.
Okay, thanks a lot.
Sure. Thanks for the question.
Hello, I have a question. The long-term care insurance program, if a family member wants to apply, is there verification needed from the federal employee that they qualify, if that makes any sense?
Yeah, that makes total sense. Good question. So basically, like I said, all your qualified family members can apply, even if you don't have a policy or don't apply. The only thing that they would need from you, or any of you if they were applying, is your social security number so that we can verify their eligibility. That's it. Otherwise, they can pay for it on their own and do everything else by themselves. Any other questions?
Yeah, we'll go out and see if we have questions on the phone line.
Sure.
Danielle, could you unmute the phones, and we'll start with questions from Region 1.
Hi, this is actually Tamika. Sorry. I also wanted to, before I open up the line for questions, I just wanted to address a whole bunch of people are actually online sending messages about slides. Is there someone supposed to be presenting on this end of the webinar, or just only in the auditorium?
Tamika, ask your question one more time.
There are a few people online asking about slides or presentations. Are there being presentations shared on the webinar where I need to give someone the presentable, or is it only being shared in the auditorium where you currently are?
So it should be shared through the webinar as well.
Okay, so do you know which person I'm supposed to give the presentable to? Because no one actually told me. Because they can't see it if I don't give them the presenter rights.
So Tamika, we'll check on that. Can you open the phone lines in the meantime while we work on that?
Sure.
To see if we have any questions from the regions. We'll start with Region 1.
No problem. At this time, we'll begin the Q&A portion of this call. If you should have a question, please use your raise hand feature and the line will be unmuted. Or at this time, we can also unmute all lines, and I can have the rest of you please mute your background noise by muting your line. And if you have a question, then you can unmute it, please. Again, the Q&A portion of this call. If you should have a question, please use your raise hand feature and the line will be unmuted. Or at this time, we can also unmute all lines.
Do we have any questions in Region 1? If not, we'll go to Region 2. And if you're not asking a question, if you could put the phone on mute.
I'm sorry. Our people are crazy.
Do you have a question? Question in Region 3? Region 4? Any questions in Region 5? Region 6? Region 7? Any questions on the phone at all? Tamika, you can...
When will 2019 materials be posted on the OPM website?
Materials specific to either benefits...
Dental vision plan comparison?
What was the question? I couldn't hear the question.
So the question is, when will OPM post materials on their site?
I actually don't know that, but if you go to the benefits website, they should be posted there.
Any other questions on the phone lines? Okay. Any other
So
questions?
the benefits site already lists the 2019 prices?
Sorry, I can't.
Will the benefits material already list the 2019 premium?
That's a good question, too. I'm not sure, honestly. Just if you would just check the website, they could be listed there, but I don't know for sure if they're all on there. But benefits.com.
So part of the response is after they make the announcement. So after OPM makes the announcement, then the cost would be shared.
Thank you. After
on the
OPM
website.
makes the
Yep.
announcement, then we'll have on the benefits website. Thank you. And I think we have one more question in the auditorium. Can we
Yes.
take that now, David?
Hi, I was in the long-term care program for a long time when it was offered, I think the first time with John Hancock. Anyway, at that time it wasn't medically underwritten, which was good because my husband already had a lot of issues, and I do now too. We dropped out 2 years ago when that the increases were dramatic, and at the time my husband was unemployed, and we did not know about that there were other options that you could keep the same premium and maybe we would, because I actually called the line, and my husband, we made the phone call and they said, look, you either have to decide to drop it or pay the increases. And we got off the phone and David said, just drop it, because we just figured it was enormous every month. Now that it's medically underwritten, I don't even think the two of us could get back in. But my question is, if you were in that position and you paid in for a long period of time, it doesn't mean anything now, right?
That's right. And we've actually always been medically underwritten. It's just that
Oh, really?
you and your husband probably got in on an abbreviated application way back in the day when there was a lot
We weren't
less.
even asked about our backgrounds at all.
Yeah, so there's always been an application since 2002, but it might have been abbreviated at the time. It might have been an open season or some sort when there was an abbreviated application. And I do know, though, that everyone who was affected received a packet with 3 to 5 different options. You can actually call customer service and have them look at it again. I think they can see it.
Yeah, but I dropped out 2 years ago, and we
Right.
never got, and I spoke to somebody. I had called from here one day after I spoke to personnel, and then we called at home. We had a long conversation with somebody. I was off work that day, so we figured we'd just sit down and talk about it. And we just said, no, it just wasn't. Also, we didn't have one of those unlimited policies either, which, it's...
You did or did not?
Did not.
Yeah.
I had like a 3-year one, and we just...
Yeah. Well, if you want, I can take your information after and I can, get you some information out about it. But there isn't anything you can do now because it has been so long. I apologize for that. But I don't know what your health conditions are now, but you can still reapply if you'd like. And I can get, like I said, your information and send it out to you if you want.
Okay.
I'll come
Think
by
about it.
after I'm done.
Thank you
You're
very much.
welcome.
Thanks.
Any other questions in the auditorium or anywhere? Nope. All right. Well, thank you all for coming and all the people working from home. Thanks for attending. Again, if you have any questions, I encourage anybody to call in to either the FELTSIP or FEDVIP. We're happy to get any information out to you either by email or by mail. So thank you again. I hope you all have a great rest of your day.
Tamika, you can remute the phones, please.
Okay, thank you, Jane, for sharing that important information with us, and thanks to the audience for your great questions. Okay, so our next presenter is Mr. David Herka, and David began his career at CareFirst Blue Cross Blue Shield in March of 1990 in the Provider Service Division. He worked in different capacities to support the region's doctor's offices. Several years later, he moved into the Consumer Direct Sales team, where he started in telesales. Then he served as a broker sales rep, supporting several of the region's general agencies. For the last 9 years, he's managed the Consumer Direct Broker Sales Division. 2 years ago, David accepted his current position as an account manager in the Federal Employees Program at CareFirst. In this role, he supports his assigned federal agencies throughout Maryland, along with 2 other colleagues. I can say CMS is very fortunate to have David as their federal account representative. Please help me in giving David a warm CMS welcome. Thank you.
Good afternoon, everybody. Thanks for coming out today. Thank you for those who are on the phone. Also here today in the audience, we have my former colleague, Bill Gray. A lot of you know him. He was with the federal program for 20 years, with CareFirst, I believe about 40 years. So I've taken his place and happy to be here to support you all. You all have me for about another 13 years before I retire. So you'll see me around CMS through the years, and any questions that you have, especially anytime or specific to retirement or whatnot, I'll be here to support you as you get closer to that retirement point. So just looking out in the audience here, I just want to get an idea of kind of where folks are in terms of retirement. So how many people are over 5 years out from retirement? Okay, how about 3 years out from retirement? 2 years out? How about 1 year out from retirement? Oh, still a few hands here. How about 6 months out? We're narrowing it down. 3 months out. Okay, so we have a little something here for you, a little gift as you move into retirement, a laptop backpack. It's a great gift here, and just the backpack. So as you're backpacking through Europe, it'll be a great thing for you to take along there. So this is one of my most popular seminars. It's very much a daunting process, trying to navigate retirement, kind of what everything looks like, what are your choices. A lot of those are personal choices. So I'm here today to hopefully make it a little easier for you to make that decision, for those that you have to make based on who you are, your personality, about some things. So let's go ahead and start by taking a look at the agenda. So today we're going to talk about important things that you need to know, specifically some of the guidelines, the rules, the mandates. We're going to talk about the advantages of the federal employee program. There's quite a lot of those, so we'll have you understand what they look like. We'll talk about Medicare, the different parts of Medicare, Medicare Part A, B, C, and D, what all those are, what they mean, how to navigate those. And then lastly, while also coordinating your plan with Medicare and how that looks as we coordinate with the Medicare program, with your FEHB plan. And then lastly, some things to think about as to whether or not you want to enroll in B, because that is a choice to take Part B. So starting with the mandated rules, the most important thing to be aware of for those that are outside of that 5-year kind of time frame. The most basic rule is that 5-year guideline in terms of you have to be enrolled in the FEHB program consecutively for the last 5 years of your employment prior to retirement to be able to take that plan into retirement. If you cancel the coverage, you're not in the plan, you're on a spouse's plan who's a non-federal, then you have a problem and you're not able to take that into retirement. So I can't tell you how many folks I come across that they're on a spouse's plan, they don't think about that until retirement's there, and because they want that FEHB plan in retirement because there's nothing like that out there in retirement, and then they find out they can't take it. So just be aware, it's extremely important that you just have that first rule down pat. Now, if you're under a spouse's plan, they're under a federal employee, that will count as part of that 5 years in that 5-year window. Also, if you're on TRICARE, that will count as part of that time that you are with your 5-year rule. So also, when you're going into retirement, you take that plan, you want to take an immediate annuity, and that will allow your spouse to be able to continue the coverage should you pass at some time in the future before your spouse. That will kind of lock them in terms of being able to keep that coverage and continue that. So you want to take an immediate annuity, and the survivor benefit is what you want to elect at the time that you're retiring to guarantee that spouse will have that coverage to continue. If you're not enrolled in the program, again, at the time of retirement, you will not be able to continue that program. So you have the option in another scenario, however, one of the exceptions where if you do want to try one of the Medicare Advantage plans, and we'll talk about that a little bit more as we go along in the slides, that is one exception where you would be able to suspend your FEHB coverage, not terminate, but suspend it. And you can try one of those Medicare Advantage plans, and then you can come back should that not be a good fit for you and your family. Also on the TRICARE, same thing. If you want to move over to the TRICARE plan after you're in retirement and kind of put your FEHB plan on the shelf, if you will, you can do that as well and re-elect that at a later time and suspend that and then pick it up down the road. So the government does still continue to contribute in retirement, which is a fantastic thing. So right now, the contribution is about 72% on average, and that would be for all different coverage levels, whether it's self-only, self+1, or family coverage. It looks a little different in retirement. So as today, you have the monies pre-tax coming out of your paycheck. It's going to be through 26 pay periods. In retirement, it moves to a monthly premium amount. So you're just going to see that as a monthly amount versus the 26 biweekly deduction. The premium will stay the same as when you're an active employee, so that's another great thing as well. Now, on the downside, your premiums will no longer be pre-tax dollars, they'll be after-tax dollars, and then you'll no longer be eligible for the FSA plan in retirement. Now, with regard to the dental does not have that 5-year rule apply to that. So in retirement, you can opt to pick up the dental or vision, drop the dental or vision. You can go in and out of that at will. Mind you, it will have to be at that open season window when you do so. You don't even have to have it coming into retirement. You can pick it up after you're already in retirement and you had that federal medical plan. But it doesn't tie into that 5-year rule. Same thing as that, it's going to be the same cost as when you were an active employee. Your premium will only increase if it increases for all federal employees as a whole. And again, you're going to see that as a monthly cost. And also, it will not be pre-tax dollars when you're in retirement. So some people have a question in their head as to whether or not even to continue with the FEHB program. My opinion is, as an outsider, is there's really nothing like that program. You have a phenomenal program to be able to bring into retirement. My mother doesn't have that opportunity. She's on one of those supplemental plans. Those supplemental plans, typically, if it's a true supplement, only pays what is covered by Medicare. Everything else ends up getting denied. With your federal plan, it's very different. So if there's items and things and services that your Medicare plan denies and your federal plan covers those services, it will pick up and cover those items in full for you. So it's a huge advantage by having that plan and then having your Medicare and in a scenario where Medicare would not cover that. So your federal plan is typically going to be a lot more robust than anything that's out there. Additionally, my mother has to pay an additional premium cost for her Medicare prescription drug coverage. So she has her medical premium, which is quite expensive. Then she's paying on the prescription drugs, and that particular program has a lot of gaps, a lot of holes. You may have heard the infamous donut hole about the gaps and holes that particular program has. So again, just want to kind of have you understand the value of your program, of what you have to be able to bring into retirement. So when you're planning for that big step, at least a number of months out, you want to make sure you get in touch with your HR person. They'll help you through that process. They'll make it easy. They'll have you fill out the appropriate paperwork, and they'll guide you through that process. So they're going to make it easy for you. So let's talk a little bit about the advantages of the FEHB program. As I said, you can take this into retirement. You have the same benefits as you did when you were an active employee. In fact, the group or the risk pool, if you will, of folks that are in the program is the same as when, it's the same risk pool. So as an active employee, you'll have new folks coming on board. So you as a retiree are going to pay the same premium as a new employee. So an 18-year-old is going to be paying the same as a 90-year-old retiree. The beauty of that is it balances out that risk pool. So that's why you're going to see your rates kind of continuing down the road be much more stable than what you currently see kind of out there in the world now with all the instability. It keeps a very stable, balanced rate. The normal trend will typically continue, which is the slight upward trend and the increase in cost, but it does insulate you significantly against all that other volatility that you're seeing today in the world out there. So in terms of if you should ever pass, again, we talked a little bit about when you retire, about making sure you take that immediate annuity and the survivor benefit. You must be enrolled in the coverage in the plan at the time of death for your spouse to be able to continue that coverage. And if you're a federal employee and your spouse is a federal employee, then you're pretty much good to go with that because you both have that coverage in your own right. So you both have the ability to have that coverage, and there's no issues in that scenario. So in regard to pre-existing conditions, again, as an active employee, you don't have that. As a retiree, you don't have that as well. So you don't have to worry about anything being denied or excluded on your coverage. So continuing with the advantages of the FEHB program, just as you do today, and you change a plan as your needs would change, as you're kind of going through life, you can do that same thing in retirement. So open season will happen for active employees. That same time frame is for those folks who are retired. So as you continue to age and we all get older, typically, life stuff happens. We typically incur more cost. You may need to shift plans, one that better meets your needs and is a little bit more appropriate for you. You always have that option as each year comes around to pick up, change the coverage as you need it, as well as the dental and the vision. So most of those are handled through OPM for folks that retiree and the retirees, but some of the agencies will actually handle that themselves. And for those individuals in that scenario, as you talk through with your HR person, you're going to know who you are if that's your situation. But most people do go through OPM to go through the enrollment process. So out there in the lobby, I had some information and a pamphlet for an organization. It's called NARF. So it's this brochure here. You can get information online at narf.org, O-R-G. This is going to serve as a valuable resource for you in retirement. So as I was talking about how easy HR is going to make it when you're retiring and you kind of move out on your way and out the door, well, in retirement, where you have a challenge or an issue, you're going to want a resource. This organization is a fantastic resource. They're actually the group that is lobbying for both your active and retired benefits as a federal employee. So it's certainly an organization that is well worth to get involved with and to support. And additionally, as an account manager, I'm out there each season at open season visiting my NARF chapters. We hold a meeting and talk about the changes and what's happening. So you'll have that opportunity to open season to not be kind of in the dark about what's happening or what changes there are. You'll have a resource to be able to attend one of the seminars to get that information. So just want you to get familiar with that. All the different counties have NARF chapters, so when you go out to the website, you go up to membership at the top and click on the chapters, and you can locate the chapter and the details of those and when they meet. It's a very nominal amount on cost for joining. It may be like $9 a year, very minimal amount. So I just want to make sure that you're aware of that valuable resource in retirement. So just as today as an active employee, if you have a life situation, you have a QLE, qualifying life event, something that impacts your situation that may impact then your need for the type of healthcare plan you have, you're able to change plans. So you have things like death or divorce or a permanent move or some of those other things that you're probably familiar with that could happen that allow you to change a plan. You have that same opportunity in retirement to make those changes. So you don't have to be concerned about having the ability to make that change should something happen. In fact, in retirement, there's some other changes that would allow you to move across some different plans. So opm.com is a great website or resource. So again, if that happens, it is going to be just during that qualifying life event period. You'll want to make sure that you do capture into that window to make that change. Just be aware as you're planning your retirement, you want to make sure the open season prior to retirement, you want to make sure that when you move into retirement, you're on the plan that you want to be in. Because the retirement in itself is not a QLE. So maybe you're thinking about retiring next July, and open season comes and goes, and you're thinking, well, in July, I'm going to go ahead and change when I hit retirement and change the plan to something a little different because that's going to better meet my needs. You actually would have to wait to that following open season. So do your planning the year out prior to your retirement date and plan that accordingly. Just be aware that in terms of downgrades, you can do that at any time. You don't need a QLE, so you have that ability to do so, which is a nice option. So let's move in talking a little bit about Medicare. Medicare is a federal program that actually is, for the most part, for folks that are 65 years and older, but also for some younger individuals who may be disabled or ESRD or certain medical conditions. Most individuals qualify for this in getting this coverage with the fact that they've worked, they've paid into the system, and they are automatically eligible. They've paid in their 40 quarters, so they're eligible for their Medicare. So there are 4 different parts of Medicare, and as you're reading the information, it does get a little daunting, confusing. You'll see the term original Medicare. A lot of times you'll just see that, and it gets a little confusing. That just means Medicare Part A and Part B, and we'll kind of dissect and take these one at a time to understand what each of these are. So Part A and Part B, in other words, original Medicare, same thing right there. Medicare Advantages are is a Part C program, and the Part D is your prescription drug coverage. So let's talk about each one of those. So your Part A is typically your hospital-type services, skilled nursing facilities. So that, that Part A, again, as I mentioned, you pay in your 40 quarters. You're going to get that without a cost. So that's provided to you at no cost. On my presentation here, I did things a little different than some others. I put things that change and possibly could change from year to year. I put that in red on the presentation, and that kind of gives you the ability to kind of see what sort of things will kind of change or move and shift in terms of your out-of-pocket cost, because I think it's extremely important for people to be cognizant of what can possibly change in retirement, because it's important as you're planning your retirement. For 2018, Medicare Part A does have a deductible. It would be $1,340. So that would be for your first 60 days of benefits. If you're going into 61 through 90 days, then you have a per day amount of 335 days as a copay. And then if you're continue into 61 to 90 days, it's $670 per day. So it can get pretty costly. Medicare Part B, so these are going to be mostly your outpatient type services. So you can see here from the list of services, those things that it would include: your outpatient doctor's office visit, x-rays, ambulance services, outpatient PT, OT, your physical therapy, those sort of things. Medicare Part B is going to have a deductible as well. It's $183. Once you meet that deductible, the plan is going to pay at 80%. On Medicare, you'd be responsible for that 20% coinsurance balance. Currently, the base premium rate for Medicare is $134. That's for 2018. Again, in red, you can see that can change. Last year, it was $134. The prior year, it was a lower cost, so it did bump up and adjust. So as a yearly cost, $1,608 would be your total cost for a year. Now, for individuals who are higher earners, there are some adjustments who will pay additional money, more than the $134 if you hit certain thresholds of income. So let's take a look at that and what that looks like. So here on the chart here, if you're making above $170,000 as a couple, as a joint filed income, then your premium amount for Part B is going to bump up. So you can see it bumps up to $187.50. If you're a single person filing and your income is above $85,000, again, you move into that second tier and level. So you can see as you move down as higher earners, you're going to pay an additional amount for the cost of your Medicare B premium. So the Part C. Part C is the Medicare Advantage plan. So I always just kind of want to put out just a word of caution if you would decide to enroll in a Part C program. You just want to make sure that you thoroughly read and investigate all of what that entails. You see a lot of different programs out there. And there's a lot that have come and gone over the years. You'll see some exceptionally low premiums. That Medicare Part C will include your Part A and Part B, and you'll still pay your Part B premium. But it could have some other things in that as well. It could have some dental. It could have some prescription drug coverage. But typically, with having a lower premium, there's a reason sometimes where they can offer at a lower premium. Oftentimes, you'll see there's going to be maybe restrictive networks, some limitations in terms of managed care, if you will. There'll be sometimes more managed care to be able to keep and maintain those programs to be viable. So just caution you on that. Again, maybe that's why the rule is that they'll allow you to suspend your FEHB program, put it on the shelf, and be able to come back in, because maybe people get into that and they realize, this is totally not what I thought it was, because that FEHB program does allow you a tremendous amount of flexibility. So just be cautious if you are taking a look to move into one of those. Part D, so the prescription plan, the Part B, you hear a lot about that in the news, a lot of the challenges that that's had over the years with gaps in coverage and such. You don't need to worry about all of that, because with your federal program, again, you keep that same plan as an active employee into retirement. That prescription plan coverage you have today is a phenomenal program. So that will serve your needs for prescription coverage. That will meet the needs and typically will well exceed the needs of the federal requirement that you have to have without having a penalty. So as you're getting towards retirement, you're going to see a lot of things coming in the mail. You're going to see a lot of stuff flooding in, and a lot of people get overwhelmed. So fortunately, you're here and can kind of better navigate that as you're getting things. For the Medicare Advantage, for the Part D, just be assured that with that federal program, if you intend to keep that, you are good to go, you're covered, you have a terrific plan in retirement. So for most people, they can take that and put it right in the trash for the Part C, for the Part D. So in terms of in retirement, and you have to file claims, where you have providers who are submitting the claims, they're going to have to do so on behalf of you, for you rather, when you have Part B and where Medicare is primary. So you're not going to have to worry about all that paperwork. They're going to have to take care of that for you, all those providers that you're visiting. So that kind of takes a layer of stress out of things. So when it gets into Medicare and in terms of going to a provider and the provider network, it does oftentimes get confusing. So I'm going to try to break that down to make it a little easier. So in your plan today, typically you'll have your in-network or your participating providers. So in Medicare, what that looks like is those are the providers that accept assignment. So it's the same thing. So that's all you need to know is if they accept assignment, they're participating in that Medicare program. So that's what you want to look at in terms of mostly it's best to get one that is accepting assignment. Where they accept assignment, they have to write off anything above what Medicare approves as a charge, and they write that amount off. So Medicare B is typically going to pay, it's going to pay your 80% of the Medicare approved charge. You're going to have a balance, and of course that's after your deductible, and you're going to have that balance to pick up. However, if you're enrolled in an FEHB program, that's going to pick up that balance after Medicare. That's going to pick up that deductible after Medicare. So then you're going to have those individuals and those providers that are non-participating. So in your world today, you know them as a non-par, non-participating provider. In the Medicare world, it's listed as a provider who does not accept assignment. They do, however, still have a cap or a limit in terms of what they can charge you, which is a great thing. So the government does cap them at 115% of the Medicare allowed amount. So let's take a simple example. If their bill is $100, $100, and they don't accept Medicare assignment, they can only legally bill you for $115, just 115% over that Medicare allowed amount. And then they have to write off any balance over that amount. Now, keep in mind also your federal plan may actually cover that 15% overage. So there's a lot of plans that still will allow you to go to a non-Medicare provider, come into the federal program, and often where they're in their network, they may cover that additional 15% overage. So you just need to know how your plan works in retirement and be educated on that. Then there's the third scenario. So this is the one to be cautious about. It's those providers who do not want to have anything to do with insurance. So you see some of those that maybe have an established practice that feel like they have enough patients where they don't need to have any kind of referrals or participating status and such. So those individuals, they may present you with a contract to sign. I just caution you, if they present you with that contract, as Bill used to say, turn around and run. Because if you do that, you sign that, that prohibits you from billing Medicare for those services. As such, you're going to be on the hook for a lot of money. Now, the federal programs most often will still cover you, but they'll just cover the amount that they would have otherwise covered had you had and enrolled in the Medicare coverage. So they're going to just cover that 20% balance. They're just going to cover a significantly less amount. And you'll be required to pay the difference all the way to that provider's charge. So just be cautious in those scenarios. So let's break down primary, secondary payer. That gets oftentimes confusing. So we're going to talk about the basic scenarios for when you're working, where you're not working. With one of the handouts, I did include a primary payer chart. It serves as a very useful tool to kind of navigate that, because after the seminar today, you may start thinking back and you take the scenario that I talked about and it just kind of starts to get confusing again. So that chart includes a lot of other scenarios for individuals, and it will help you to understand, when your particular situation, who pays first and who pays second. You can find that in the back of the FEHB brochure, but for your convenience, I included that as an attachment. So definitely, keep that in safekeeping with your information from today. So to break it down very simply, if you enroll in Medicare and the FEHB program and you're still working, the federal program is going to be your primary payer. Now, generally, it doesn't make sense to enroll in your Part B coverage when you're still working and you're active. It doesn't make sense. So you do have the option to do that, but I would say typically you're not going to want to do that. Additionally, you would save that $134 a month. Now, at age 65, you're still working, you're going to be eligible for Part A as well. My recommendation is just get the Part A, take the Part A, it'll sit there, it'll be in place, it doesn't cost you anything because that portion or part's free because you've paid in the appropriate number of quarters. But for that Part B, just let that stay on the shelf right there. So switching the tables here, a scenario where if you're enrolled in Medicare Part B and the FEHB program and you're retired, it then flips around and Medicare is going to be the primary payer and FEHB program is going to be your secondary payer. Now, some of the carriers out there will do an automatic rollover of claims. So, the Medicare providers are going to submit those claims for you, and with some of the carriers, they're going to automatically roll right over into Medicare and process that, from Medicare into the federal program. So at a point in retirement, this actually does become beneficial for your Part B coverage. So we're going to talk a little bit about that in just a bit. So it is a choice in terms of whether you get both, whether you just get the Medicare, whether you just get the FEHB program. And again, those are things that we're going to talk about. But when you have both, your federal program acts as a supplement. So when Medicare was originally designed, it was never designed to stand on its own. It was designed to actually have something kind of wrap around it to make you whole with your benefits and protects you at a higher level. So let's take a look. Some people are a little bit more visual in terms of kind of what that looks like in retirement. So as an example, I took the federal employee program, or the Blue Cross Blue Shield standard option, took a scenario where there's a hip replacement. So you can see on the first column there, it's what typical services you might incur while you're going through that situation. On that second column there, it's going to be your normal cost share that you might see for having those particular services. Now, on our plan for the standard, I included the cost of what that looks like if you do have that services and you don't have Medicare Part B. You're looking at about $3,322 and some change as being your out-of-pocket cost. Now, had you pick up the Part B, that's that final column. That will have waived your deductible and your coinsurance or your copays in that scenario for all your medical care. Now, when it does that, typically when it waives all that, your outpatient prescription coverage will maintain those copays. They may adjust, they may go down a little bit, but all your medical, coinsurance, copays, and your deductibles goes away. So essentially what you're looking at with out-of-pocket cost is your Medicare Part B premium cost, and that's what we talked about earlier. That was your $1,608 and some change there for your cost. So had you got the Part B, you're good to go. You have your Medicare B premium that you've been paying. You realize a savings of just over $1,700 in that scenario. So let's talk about some other things to kind of factor into your decision when it comes time for you to make that. There are some gaps or some limits with regard to Medicare. Now, we talked about some of those, which were the deductible that you have for Medicare, the per per day copay if you're in the hospital for a length of time, your Part B deductible, your coinsurance, all those things. Again, all in red, all things that can change and increase over time. Medicare also does exclude certain services as well. Things like dental services. Most chiropractic services are going to be excluded. Anything overseas, hearing aids. My mother just had a situation last year. She needed hearing aids. Medicare does not cover them. She had a 100% out-of-pocket cost on her hearing aids. With the federal program, Medicare would deny it, and it would pick it up on your federal program at 100% for that full benefit that's allowed on your federal program. So, in retirement, maybe you plan to do a bit of traveling and you're going to go overseas. Again, Medicare is not going to cover that. So just again, be cognizant. What are your plans in retirement? What's that look like for you? You know, if you're going to do that and do the traveling thing, you want to make sure you have a plan that's going to appropriately meet your needs for when you're overseas. So just be aware that if you do get a regional plan or an HMO, you don't need to be concerned that you're not going to have coverage when traveling or overseas, because sometimes they do have some networks or some ability to coordinate some care overseas. But in any plan that you go to, regardless of that, it will at least have urgent or emergency care overseas. So again, some of those other plans, you're going to see some networks, some of the PPOs, fee-for-service plans, some of those have plans and networks overseas that will cover you. So again, just be aware of what your needs are when you're planning. Now, when it comes time to enrolling in Medicare, you're just going to want to make sure that you're going to do it timely. So my brother-in-law, he's a little kind of passive, you know, laid back, and he kept waiting to apply, waiting and waiting. His birthday came and went, and he still hadn't applied, and my sister had to get involved and light a fire there. So he ended up getting enrolled. He had a problem with the Medicare eligibility. They had a hiccup there. So his effective date pushed out further. So he did actually have a window of time where he had no coverage. I just caution you to make sure that you do you start the process early. We'll talk a little bit about what the process window is. Some people are going to get something in the mail automatically, and it's going to enroll you. And for those people, it's typically those who have been receiving some sort of benefits, Social Security benefits. The government has your number. They know who you are. They've got you in their system, so they've kind of tracked it, and they'll send it out. But for, I would say, the majority of folks, you're going to have to proactively initiate that process, call up, and get the paperwork and enroll. So what does that look like? Well, there's 3 different enrollment periods that are potential scenarios. So the first is your IEP, your initial enrollment period. That's the time when you're first turning 65 and you actually do qualify and are eligible for Medicare. You want to get that coverage at the time where you initially are eligible if you decide to get Part B, because you avoid any penalty. The window to enroll is a 7-month window. It's 3 months prior to your birthday, your month of your birthday, and 3 months after your birthday. So you have that window. Again, initiate that a couple months before your birthday so you don't run into the problem my brother-in-law did. If you delay getting the Part B and you're actually eligible and you should be taking it, you're going to be penalized, and it's a penalty of 10% for every 12 months that you do not enroll. So the second scenario that you could come across is the SEP, or the Special Enrollment Period. So for individuals who are still working, as I was talking about before, it doesn't make sense to pay that premium to take the Part B. You kind of put that on the shelf. You've got your Part A. You're good to go there. Well, you decide it's time to retire, so you submit your paperwork for retirement. In retirement, that's the window when Medicare Part B becomes a good thing, and it's beneficial. Then at that point, you can enroll in the SEP. It's for people that didn't elect it initially when they turned 65 because they were working. They turned 65. They're eligible, but again, you didn't take it because you didn't need to. Well, you're good to go. You retire. that's when you want to take it. That's when you qualify for that special enrollment period. You get in at that point with no penalty. The enrollment period there, you're going to want to make sure that you're getting in based on when your coverage is ending. So, just be cognizant again, you've got a window of time to enroll. And lastly, it's for those people that just didn't want to have anything to do with Medicare. Maybe it goes down the road a little bit. Maybe they incur some additional medical expenses due to some health conditions or something happens, or maybe they have a change of mind in terms of, I need that extra protection. If they want to enroll at that later point, that's going to be the scenario where they have a penalty that applies. So there is a general enrollment period. Those individuals can come on board, can pick it up, again, having the penalty. That window is January 1st through March 31st, which is going to be kind of your open enrollment window. Now, keep in mind, it's not going to be effective till July of that year. So you have a situation, you want to pick that up, you want to pick it up real quickly, well, you're going to still have a delay. So just keep that in mind as well, that would be the scenario. So, in terms of determining your cost on your premium, because I know you may be thinking as you're looking at that, am I a higher earner, and that's going to get really expensive for Part B. Well, for most of us in retirement, our income goes down. So just be aware of in retirement, your premium will adjust accordingly. When they initially take and set your premium amount, if you're in that age, up to $85,000 or $170,000 first level, you're at the $134. If for some reason you exceed that and you're still working, they're going to go back 2 years when they go in and they determine your eligibility and they determine what your premium cost is going to be for Part B. So it may be an inflated number, but just be cognizant. You have the ability to always to appeal that amount as with your premium amount, because again, going forward, typically for most, as I said, it will drop lower. So you can have that premium adjusted and to go lower. So you can submit in an appeal. If you have a QLE, qualifying life event, and you have this scenario where there's an adjustment, maybe your income's affected. Again, I said there's some other scenarios. Spouse's pension, something happens there and whatnot, and you want to enact your QLE to make a change, you can do so. They're actually going to use a more recent year. But for some reason, they do a 2-year out when you first come into Medicare to establish that rate. But if you have a QLE, they're going to use the most current information as with your premium. So let's talk a little bit about the penalty and what that looks like. Again, it's going to be 10% for every 12 months that you've not enrolled. It's going to be for the rest of your life. So that never goes away. And that'll be based on the Medicare base premium amount. The penalty is going to be added on there. So let's take a look at what that looks like for those folks that are a little bit more visual here. Again, this slide just saying there could be no upper limit to that penalty, so it can get pretty expensive. And again, you have the ability to appeal that amount if it's not accurate with regard to the premium for Part B and what your true income is. You can, again, appeal that. So as an example here, somebody's waited, say, 3 years. They've decided, no, I need that Part B. I really need it. I want it to wrap around. I need more coverage. They're going to pick it up. They're going to have a 30% penalty. So that 30% penalty, again, is going to be on the base rate of $134. It's going to be $40.20 per month that they're going to pay as a penalty on top of their base rate. So if they're that level 1 category income, there's $134. That $40.20 adds on to there, then you're going to be paying $174.20, assuming the base rate's $134. If you're at a higher earner and you have a higher premium, it's going to take that $40.20 added on to that base rate there. So say you're at a level 2, $187 and change, add the $40.20, you're now at $227 and change for that penalty. Again, that never goes away. Now, you can opt to enroll, disenroll, enroll again, and you can opt in and out. But again, as you do so, that penalty will continue to accumulate. Should you come back in, you will pay that additional accumulated time. Your penalty will go up. So some people, they get all nostalgic and they start thinking about, the yesteryears, and a loaf of bread was a penny and a gallon of gas was a nickel or whatever that might be. And Medicare was $3 a month back in 1966. And so, they start questioning, like it was $3 back then and now it's $134 a month. So it can be an emotional process, It's an amount every month you're paying. It may be a financial strain for some people. That's why I try to caution people, just kind of make sure you take off the blinders, know things can change as you're trying to think through the process. So, $134 for current, you have additional for the means testing. So just things to think about. Everything is going up, inflation's here, and impacts everything. Additional things to think about, as I mentioned, as we age, typically we're feeling more aches and pains. I know I am, as I've hit the 50 mark and moved past that. The FEHB program itself, the one you have today, that could change itself. Your coinsurance, your deductibles, your copays, your out-of-pockets. So again, we see the volatility of the market today and how things have radically shifted. That plan and program can change over time and most likely will change over time. So just things to be cognizant of. Medicare Part A and Part B, the out-of-pocket costs there, those can change as well. So again, you have to look at the whole picture. So a lot of times this comes down to, you're going to have to do your own analysis. On this particular slide, we take a look at the big question, right? To be or not to be. So do I take it? Do I not take it? You're going to have to, it's a personal decision, kind of based on your personality, who you are. So as a base, again, that's why I caution you, use this guideline as a base, as a starting point. Take a look at this last year. See where things were. See what your out-of-pocket costs were. See if did you hit your out-of-pocket? Did you have some things going on? Have you had that for a few years? That can be your baseline. But then take off the blinders, get in the world of reality, understand that through life, typically, we have higher expenses, things change, those out-of-pocket costs change on your current plan, all those other things we talked about. So use this as your base and your starting point to determine, as you're working through the process. What kind of person are you? Are you, I want peace of mind, kind of slow and steady as she goes? Are you the risk taker? Are you kind of weighing out rewards and, as my federal employee friends who were getting ready to retire, that was a number of years ago, they said, we're going to roll the dice and we're going to kind of we're not getting the Part B and we're going to see how this all goes and turns out. So they were working into their 70s, so they were just kind of planning, we're pretty healthy now, I think we'll be okay. At age 65, if you don't have Medicare, your FEHB program will be primary. You just use that as you have used it today. It continues on. It will change as it has today over time. The cost, the benefits potentially changes. Just know, again, do your analysis. What are your out-of-pocket costs? What does that look like? Advantages here we can see for folks that are federal employees and you have a spouse who's a federal employee. You have some other advantages over other people because if you're actively working, you're a federal employee, your spouse retires, that spouse should stay on your plan. When they do that, you realize the benefits of that pre-tax dollar savings. So if that person, and I've seen it, the retired person goes on their plan, the active employee goes on their plan, they kind of separate that out and they think that's what they're supposed to do. Well, if that retiree went on that active plan with that member, you still have the benefit of that premium deductions as pre-tax dollars. So that right there is a savings. Also, if you're the retiree, you're over 65, and you're on that active employee plan, you do not have to take the Part B. It's going to save you $134 currently a month. So there's a number of different advantages. You can enroll in and participate in that FSA program, where as a retiree you cannot. So again, some things to think about. Compare your premiums to as a whole, regardless federal employee or not. You know, take a look at 2 individual plans, self plus one. Maybe you're in the family kind of situation and you still have some kids. Take a look at this, you know, do some of the math and break that down to see what's going to be the best for you. Again, do your comparison, look at the plan, what are your needs in retirement, you know, target in on that plan and program that's going to best meet you and your family's needs. Again, it's a great value, no pre-ex, great comprehensive coverage and benefits, coordinates with Medicare and fills in all those gaps. Just a lot of great advantages for a reason to be enrolled in the FEHB program. So these are great resources as well. OPM.gov has a lot of great information, a wealth of information out there about retirement, about some of those quirky scenarios and situations. You can always go out there, you can go into documents, you can control F and do a searchable, in a searchable area to, do a search on a particular topic or situation. Medicare.gov gives great information on the basics of Medicare, navigating that process as well. And again, I'll be around and available for you all for at least another 13 or so years. And stop by, we can talk, and especially as you're kind of nearing retirement, things may be a little fuzzy, you need some help, I'm available for you all the time as well. So I'd like to thank everybody. But first, we'll go ahead, we'll open that up to some questions. Any questions in the audience here? Yes.
Yeah, so if I retire at age 65 and my wife is 5 years younger than me, can my wife, will FEHB cover my wife in full even though I'm on Medicare?
So in that scenario, again, an option that you would have that would be a really good option is if your wife, being younger, is actively working, you're retired, if you are on her plan, on the active program, you avoid, number one, paying that Part B premium. Number two, you have your pre-tax dollars that's paying your premium versus if you're retired and have your own program. So you have a lot of advantages there.
But my wife is not a federal employee, so I don't want to leave the federal employees.
Okay, I'm sorry, I misunderstood that.
I should have made that clear.
Okay. So in that scenario, the question being where the spouse is not a federal employee, if you drop that FEHB coverage, you will not be able to pick that back up.
But can my wife remain on the federal employees health benefit plan and be covered in full, even though the FEHB is secondary to Medicare for me?
Yes, she can. Yes.
Okay. And then if I delay retirement and continue to work, and I don't sign up for Part B right away, I get the special enrollment period when I leave work. That's for 8 months, right? Is that the special enrollment period for Part B, 8 months long?
Yes.
So would it make sense at that point to delay enrollment in Part B until the last month so that you don't have to pay the premium for the first 7 months of Part B?
So if you delay I'm just trying to think through that scenario. Bill, do you want to?
What you could do is...
You make sure to talk in the microphone
what
there.
Dave has already said. I'm already over 65.
Okay.
Listen, what Dave said, what you would do is consider your options, consider what works. If you don't have a whole lot of expenses, sure. But if one of you has a condition and you notice I'm passing my catastrophic limit and our combined expenses, then take Medicare.
Okay.
Don't wait the 8 months then. You want the Medicare to be part of the game.
Okay, great. All right, thank you very much.
Okay, next question.
Okay, let's talk about the special enrollment, the special enrollment period. That means if I'm still working and I become 65, I don't want Part B, obviously, because you said
Correct.
that's a no-brainer.
Right.
So it says here, contact Social Security to let them know you don't want to exercise this, that you do want to exercise the special enrollment period. Could you tell me what that means? Are we supposed to get something in writing, or?
Yeah, well, like I said, sometimes people find that they're already getting information in the mail to enroll in that. You can send it back, you can decline that, but yeah, you would want to decline the Part B coverage because you do not want to pick that up.
No,
And conversely, at a point where you do retire and you pick that up, you're going to want to let them know that you did exercise that special enrollment period, and then therefore you're not incurring any sort of penalty.
Yes, but do I have anything in hand once that happens, if there's a confusion, that yes, I was eligible for the special enrollment period? Is there anything that let's say I just send it back and say, I don't want the Part B now because I'm working and I don't need it. I'm covered under something else.
Right.
I know that and you know that, but
Right.
I just worry that they're going to know that 3 years later when I go in and they say, oh no, you got a penalty. I
Right.
say, no, I wasn't supposed to get a penalty.
Yeah, so
Is there anything
Bill, do you
in
know what
hand that proves it?
the paperwork is that would verify that proof
First
of?
thing is you can enroll or decline Medicare Online. So you can just go on a couple months prior and say, I'm turning it down because I'm still actively employed. Then the employer generates a form when you retire. And on there it says, now for me it worked fine. For my wife it was a disaster. But it depends upon the employer.
Was she a government employee also?
No,
Oh,
thank
we're
God.
talking government.
Yeah, and what she did is, I suggest you do it 3 months before you retire, request the form, because once you're retired, you depend on OPM. They're a little bit slower in processing. Whereas if you request it through CMS before a couple months before your retirement date, they'll give you the date of your last pay.
And what form is that? Just
I forget the name of it. It's SS something or another. It's a form that's available online. You can go in. Worst case scenario is call Social Security's 800 number. They'll tell you.
So that's just going to prove when my last paycheck was. It's
Exactly.
not really
It's
pertaining to this.
That's what it is. When I say last paycheck, it's your last active paycheck. You are no longer working there.
Then that's your proof to go to Social Security.
That is,
if there's a problem.
you submit, actually, I dropped it off the Social Security office. You don't even need an appointment.
Perfect.
And then I got confirmation that it was posted. Social Security offices get back with you faster than you ever believe.
Yep.
When you go-
Thank you, Bill.
They
So,
go online.
yeah, so that's, Bill's gone through the process, so he's had all that fun and experience, as you can hear, so, yep.
Okay.
So you're comfortable, and we'll be available after as well for additional
Yeah, 'cause
questions.
that's coming up really
Yes.
soon for me, like next year. So I wasn't, from what we learned here today, I'm not even thinking about, do I need Part B when I become 65? Because I don't, as long as I'm still working. That's a no-brainer. So then my other question was, do I need Part B? And it sounds like I will take Part B, but it's questionable. I mean, for some people it may be questionable. I'm the kind of person that doesn't like to worry, so I'm going to take it. But
Right.
that's not until after I retire.
Right,
Okay.
because at that point, you take the Part B, again, it gives you that peace of mind.
Yep.
It wraps around, it covers all those balances. You're not impacted down the road with all the changes, premiums, out-of-pockets, your plan.
So you've helped
It gives
me
you a
out.
lot more peace of mind.
Yeah, you've helped me with my decisions, and thank you.
Great, you're welcome.
Tamika, we'll open the phone lines, see if we have any questions from the regions.
Sure. Would you like me to open the phone lines completely, or would you like me to individually mute people? Because if I open them completely, it's kind of hard for me to determine who the regions are unless I open them up completely.
Yep, we can start with Region 1.
Okay, but that's what I mean. Like, it doesn't say by region, it just has their name.
You can open the phone lines completely.
Okay, thank you. At this time, we will start the Q&A session of this call. If you have any questions, please feel free to ask a question at this time. Please understand that your background noise can interfere with the call, so please make sure that you mute your lines if you're not speaking. At this time, I will unmute all the calls.
Hey, we'll open the phone line. Do you have any questions from the region?
Any questions from Region 1? If you're not asking a question, if you can keep your phone on mute. Any questions from Region 1?
ठीक हूँ ऐसे तो, लेकिन वो भैया वो है ना जब ये डायरेक्टिंग हो गया तो
I'm sorry, is that a question? Any questions from Region 2? Any questions from Region 3?
Region 3 has a question.
Go ahead.
Two questions. One relates to as in retirement and the well, currently working. In retirement, can the retiree HB and not buy Medicare Part B, or how does one access the FEHB insurance?
Did you get enough of that?
I
Dave?
didn't hear with the background.
If you can repeat that question one more time, you sort of
Yes.
faded out there a little bit.
Okay. As a retiree, can the retiree keep FEHB and not Medicare Part B, or does the retiree buy Part B, and how, if so, how does that person get FEHB insurance?
Yeah, so as a retiree, you do have the option to just take the FEHB program, and you do not have to take Medicare Part B. So if you would elect to take the Part B at a later point in time, and you don't take it when you're initially eligible, you'll incur that penalty for the amount of time that you've not had that. So specifically 10% per every 12 months that you've not had coverage.
Okay, thank you. And my second question relates to working and have Part A and FEHB. If you can tell me how, if a person is hospitalized, who pays, does Medicare or does FEHB for the hospitalization and all of the services during the period of hospitalization?
Right, so you would have the Part A, and the Part A would be the primary. Or, I'm sorry. If you're still working, Bill? I'm sorry, I'm not sure I understood.
If I understood you correctly, you said you're retired.
No.
You're still working?
Still working, have Part A, and have FEHB. No
FEHB would be primary, and as you notice the size of the Part A deductible, you probably wouldn't get much payment from Medicare. But if you're in a skilled nursing facility, the answer could be entirely different.
Right, so again, the key there is that you're still actively working. So the federal being primary.
Then FEHB would pay as though Medicare doesn't exist, Part A?
Yes, it would pay just as it does today.
Okay, prior to being on Part A.
Yes, correct.
Okay. Thank you very much.
Welcome.
Any additional questions in Region 3? Questions from Region 4? Questions in Region 5? Region 6? Any questions from Region 7?
Yes. The question is, when you retire because you're civil service, which is prior to age 65, once you do come on, or can come on at age 65 to Medicare, is that constituted as the same as a working person? So you can apply 3 months before or after your age 65? Or the special enrollment period, which is January, February, March of that year?
Okay, I'm sorry, if you can repeat that. So you're under 65, you're retiring, and you're eligible for Medicare?
Not yet.
Okay, so if you repeat the question, I'm sorry.
Under civil service retirement, retire before age 65. At the time when I'm 65, I will be retired. So am I constituted as a retiree that worked? And therefore I can apply 3 months before age 65 or 3 months after? Or do I have to wait to the special enrollment period, January, February, March of the following year?
Okay, so as I understand it, what you're saying is that you're under 65, you retire, down the road, you turn age 65. At that point, you do have your special enrollment period. So that would be your 7-month window, 3 months before, the month of, 3 months afterwards. That would be the time that you would have to enroll in that Medicare Part B.
So I'm treated as though I am still, quote unquote, a working person at 65, because that's how they're treated.
Well, no, because as I understand, you're saying you're going to be retired prior to age 65.
Correct.
So if
but
you're
I'm treated as though, if that's the case, then I'm treated as though I retired before, and now I get 3 months before and 3 months after.
yeah. So Bill, because I'm not quite understanding.
If I understand you correctly, the confusion is over what is initial enrollment period and what is special enrollment period. The
Right,
fact
when a
that you're
retired
retired, that's
Correct.
the 3 months before, 3 months after, and month of. The special enrollment period is straight 8 months. So you're under initial enrollment period, and that you'd be just like anybody else who turns 65.
All right, thank you.
Yeah.
Any other questions in Region 7? Region 8?
Yes, hi. If I have a government employee medical insurance plan, should I use or enroll with Part B plan? Does the current medical insurance plan become secondary? Would replace Part B, or I should enroll in Part B as well with the plan?
Okay, again, just to clarify, it's a little difficult to hear, at least at this angle here with the speaker. So are you active or retireed in this scenario?
Active.
Active, that's what I thought. Okay, so if you're active, you're age 65, in that scenario, it doesn't make sense to get the Part B coverage and enroll in Part B. You can take the Part A, you put that in place, there's no cost to do so, it just sits on the side there for you. The time when you'd be concerned about enrolling in the Part B would be a time where then you decide to retire. Then at that point, you'll have your special enrollment period.
So the Part B, during the retirement enrollment time, that's something that I need to take during the retirement along with the federal health program?
So as I understand your question, if I'm understanding correctly, the question is, do I need to take the Part B? So retirement comes, I'm turning age 65. No, you do not have to take Part B. Part B is a choice in terms of whether or not you want to take it. But again, keep in mind, if you elect not to take that when you're initially eligible, then you would incur the penalty at a later point if you decide to enroll in Part B.
Right, but what is the benefits for the supplemental, the current health insurance plan, the federal health plan currently? What is the benefits of that program over Part B?
Yeah, so I'm not sure. It's a little difficult from this angle to hear the question. Bill, did you capture what that was?
If you watch the slides, is that FEHB, that's regardless of who the carrier is in many regards favorable to Medicare, because if you don't take Part B, you're still getting coverage. If you did pick Part B as an active employee, only ones who should consider that is if they have a really serious medical condition and they hit their catastrophic limit every year. Once you retire, FEHB is not what a true supplement is, because as Dave had on that slide, and I can attest to, they don't cover hearing aids. Big important to me, because I wear them. And there are other things that Medicare does not cover, that because FEHB doesn't meet the definition of a supplemental plan, they offer benefits not covered by Medicare. And that's where the advantage comes in. Yes.
Unfortunately, we didn't receive in region the slides. I would appreciate if they can send it via email.
You mean what was on the slides?
Right.
I'm turning to the staff here. We'll turn that over to the staff.
Say again. Can you get the slides? Yes, yes. Anyone who needs the slides, just email the HR help desk at cms.hhs.gov, and we'll be happy to provide the presentations to you. If you want to submit questions to that same email address, you can. Again, it's HR Center Help Desk at cms.hhs.gov. And we're still in Region 8. If there are additional questions for Region 8?
Maybe one additional question for Part C. Is the premium for Part C is higher than Part B?
I'm sorry, is the what higher for Part C? The premium.
Part C
So,
premium.
so Medicare, so Part C, again, Medicare Advantage plan, that will vary. There's a number of those out there in the marketplace. The premium can be all over the place. Now, for a while back, I saw some extremely low, and they had no premium cost. It's been quite all over the board. But no, your FEHB program is typically going to be. It just depends on the plan. I can't say, I don't want to misstate anything, because you'll have to evaluate and go out and take a look at the Medicare Advantage plans, and that'll give you a basis. If you go out to the OPM, is it on the OPM website?
It's on OPM's website, but sometimes you can overlook the fact you must have paid for Medicare Part B.
Right, so you're going to pay the Part B premium. So you already have that out of pocket. You'll have your Medicare Part C will act as your Part A and B, but you're still paying the Medicare Part B premium. But yeah, I would recommend opm.gov, to see what's out there for Medicare Advantage.
Thank you.
Region 9, questions? And Region 10. So no additional questions. Tamika, we can mute the phones again. And Dave, there are no questions in our inbox. So I think we've exhausted all of our questions. And I think Diane has just a couple of closing comments.
Great. Thanks
before
again,
we
everybody.
dismiss.
I look forward to seeing you over the next couple of years.
Okay, so I want to thank Dave Herka and Bill Gray for joining us today and giving us valuable information on the alphabet soup of Medicare's A, B, C, and D. And I also want to ask everybody, if you can, to save the date. Every year we sponsor seminars throughout the year, and I just wanted to share 2 upcoming seminars. The next one will be October 4th. And October 4th, there will be a seminar on TSP, and that will be planning for retirement and beyond. So if that's important to you, look out for that broadcast. And afterwards will be where all federal employees will be in this same room and looking in the OPM website for the annual federal benefits open season. And our fair date here in the auditorium will be November the 6th. So save the date. Look out for the email broadcast prior to the events. And please remember to turn in your surveys. We appreciate your feedback, and we really appreciate your time joining us today. Thanks again to everybody. Thank you.